Hi guys, and welcome to another episode of the Coronavirus Diaries. Today, I have my guest here, Ben. So Ben, can you tell the audience, kind of give them like a little background about where you are, what you do for a living?
Yeah, absolutely. So I'm a registered nurse. I work at a large hospital system in Minnesota, and I currently work in a ambulatory outpatient setting. Um, so yeah, that's the gist of it.
Okay. Can you kind of go into more of detail on what you do? Because I don't know what your
Yeah, that's
position is, so
that's
just kind of
yeah,
describe it.
yeah, that's fine. So the setting that I work in is so the patients are considered outpatient rather than like inpatient. So I don't
Okay.
I don't work with people that are acutely or immediately sick. People come in. I work in a radiology area, so people come in for like CT scans, diagnostically, and basically they just come in. We get them ready for the scan. They go back, get their picture taken, and then they go home. So
Oh,
it's
okay.
I work mostly with like healthy people. Um, so I'm not, I guess, immediately as affected as other nurses are dealing with this whole situation. But it's definitely impacting our day to day.
Okay. Can you maybe go into detail how the coronavirus is um, kind of affecting your work life, and then maybe go into more of a personal life?
Absolutely. Yeah. In so I guess when this first all started,
Mm-hmm.
um, we I guess the first week after it was declared a pandemic, we had like a sharp drop in the amount of patients that were actually coming in. People were just voluntarily not coming to their appointments, to
Oh.
just like proactively protect themselves. And then the following week, we started canceling a lot of appointments. Basically, like the whole facility has been working to like limit the amount of people on site that don't need to be there. So we're really only scanning people that need this diagnosis for something that's immediate. So we're not doing like routine as much sort of routine stuff. It's more urgent. It can affect their health within the next few weeks, basically, a
Mm-hmm.
couple months. Otherwise, everyone else is being asked to wait, just to really limit the amount of people on site. Um, addition to that, with the whole campus is on lockdown, so everyone has to come in through kind of just a couple main entrances, and they're screened and temperatures taken, and they're like their appointments confirmed, so people aren't just like getting into the facility without a reason for being there, basically.
Yeah.
Um, I believe at this point, inpatients aren't getting visitors. They're really just doing everything they can to limit the amount of people on site. In our work areas, we're kind of separated. So instead of basically, they're just doing everything they can to like social distance us within the role. So one nurse is assigned to like a certain area, and we have
Mm-hmm.
kind of separate sort of pods, just to kind of keep us from interacting with each other as much as possible. Um, as of last week, we're all masked all day, and all patients are obviously all screened for symptoms. Yeah, I said that, and um,
Okay.
kind of if there's anything suspected, they're pulled out. Um, kind of put further screening, further testing, that sort of thing.
Okay. I guess speaking of masks, I actually have an N100 respiratory mask that I got maybe from my boss, and I was just kind of curious. Is this what kind of like would this mask kind of help like the common people? You think for just to kind of prevent the coronavirus, for so they don't get contacted, or is this a little too
Yeah.
extreme?
Right. So I guess masks is like a hot topic right now.
Yeah.
Um, um, so for most people, like an N95 is going to be overkill. If you already
Okay.
have it, if you already own it and you've already purchased it, and you have like one sitting in your house,
Yeah.
sure, like use it. But we don't want people going out and buying them, because globally there's an extreme shortage, and those are needed in hospitals where people actually have the virus, and our frontline workers are need to protect themselves. Um, one of one of the biggest things with, flattening the curve, that's like the buzzword of the day.
Yep.
Um, One of the biggest things with that is not just reducing the amount of total cases, but it's also protecting our healthcare workers so that they're able to come to work day after day and continue to take care of these patients. Because if we end up with half of our frontline staff sick and
Yeah.
quarantined, we're not going to have enough staff to take care of these patients. So yeah, as much so, like, if you have a stockpile of N95s or even surgical masks, like, consider donating to your nearest hospital. Um, there's just they're hard to come by. FEMA's been the Federal Emergency Management at the
Yeah.
national level has been buying up like everything and then deciding how they're going to distribute, and so
Oh,
that
okay.
makes it hard for individual facilities to get their hands on anything coming down the pipeline. So it's all about conserving what we have as much as we can while still protecting our staff and protecting our patients as much as possible.
Sure.
So let me make one more thing about masks, because I didn't talk to just day-to-day people. So
Oh, sure.
so you already have an N95 and you want to use it, sweet. Um, Other than that, like, going out, get any sort of mask is going to help reduce the spread. So like cloth masks people are doing. If you have surgical masks, that's great. Even like the masks people wear when they're painting.
Mm-hmm.
Um, all that does is, when you're in public, that keeps all of your respiratory droplets to yourself. So one of the big challenges with this virus is that it has such a long incubation period. So it can
Mm-hmm.
be it's often weeks that someone has been contacted. It has the virus actively, and they're contagious. They're spreading it, but they have no symptoms for weeks. And so you need to assume and behave as if you and everyone else is already infected. And so if you're every time you go into public, you assume that you have the virus, then it's
Mm-hmm.
your job to protect other people. And so a mask helps keep your respiratory droplets and your virus to yourself. Along with that, washing hands, before you leave. If you can bring hand sanitizer with you every time you enter a new place,
Mm-hmm.
if you touch anything, just being proactive with hand sanitizing, hand washing, and then yeah, masking when in public is key. If everyone can do that, we can definitely save lives.
No, that's very good. Just kind of going back. Can you kind of maybe describe me, like, what's your day-to-day process? Like just say you got called in. Can you kind of maybe
Mhm.
describe me?
Yeah, so like I said, our area is doing a lot less business than we normally do, and
Right.
so they took our staff and split us in half, and so we're working 1 week on, 1 week off, because we
Okay.
just don't have that many people there. It's like I said, we're trying to limit the amount of contact between staff, and if we have nurses just twiddling their thumbs, then it doesn't make sense to have us on site. So we're splitting us that way. And I will say that they're taking measures to prepare to redistribute resources if it
Mm-hmm.
becomes necessary. So they're having all of us do sort of online training to the inpatient side, and some just so that we're ready in case we get enough inpatient nurses that are sick and not able to work. We'll be able to kind of slide into those roles and keep things rolling. So that's part of it. So day to day. So 1 week off, I'm just home with my family, and
Mm-hmm.
then 1 week on site. I don't. It doesn't really. So I have to take my temperature before I go to work in the morning, and if I have any symptoms or anything, I have to call this hotline and get tested. I actually had to end up getting tested a couple weeks ago just because I had like a cold,
Oh,
um,
okay.
but because it was a cough,
Yeah.
I have direct patient care. They're
Mm-hmm.
being very, very cautious. So I had to get tested and stay home for a couple days, and that was negative. So
No, that's good
so
sign.
far so good.
Yeah, that's speaking of testing, um so a couple of my family members, my sister-in-law more specifically, she's had hard time getting tested. I
Mhm.
was just curious, since you're kind of in the healthcare industry,
Mhm.
I was wondering, how do they determine that? Can you maybe describe like a
So I guess
situation?
so. I'm going to answer that by going macro first,
Sure.
and I think something that's being maybe not communicated well is that, like, for the vast majority of people, we
Mm-hmm.
don't care if you have it or not. if you have symptoms, if you feel like you have an upper respiratory, if you have a fever, anything, we want you to pretend that you do and
Mm.
stay home. You know, there's no reason that you need to be tested, because unless there's a reason that you need to be out in the world. So I guess if you're an essential employee and you're going to a job,
Yep.
then yeah, we need you to be tested. But for the vast majority of people that are home anyways, it just makes more sense to keep people in their home and just assume that you're infected, quarantine, and then go about your life. So the tests we really only need for people that either are essential, they're going out and working, or healthcare workers that are working with patients directly. We want to make sure that they're not infected. Um, but I know that there's tests have been also kind of hard to come by, and so we're trying to conserve that resource as well, um, by just making sure that we're only using them on the people that really we need to know whether they're sick or not. Does that
Very.
make sense? I don't know
Yeah,
if I
yeah, yeah.
explained.
No, that totally makes sense. Um, okay, yeah. I was just kind of curious about like how do you guys kind of did that, or like I liked
Yeah,
your
I think
explanation. It was
I think
really.
I think it varies system to system too. There's not like a unified. There's not very strong leadership from the national
Oh,
area. So everything's really getting determined regionally and system by system. Um, so it really depends on where you live and who your network is, your provider network is. That's going to determine, whether or not you get tested, and how they're going to handle that. So
oh, okay, cool.
yeah,
Yeah, I had no idea how that happened, so that's very cool.
yeah,
Um,
no, actually really cool. The Monday after, so I think it was like a Friday that
yeah,
we started the Minnesota stay-at-home thing.
yep, with Governor
The
Walz.
Monday after, Governor Waltz had a town hall with like the nurses union, so like
Oh,
all nurses of the state could call into this number and be on this town hall with him, and he kind of explained what they're doing at the state level to support us, and kind of what everything that kind of impacts us. And then
yeah,
there was a portion for nurses to like ask questions and kind of have a dialogue. So it was really cool and really like helpful. I've been really impressed with his leadership throughout all of this. Definitely being very proactive and um, taking the steps necessary
yeah.
to protect citizens.
That's very cool. So you said you participated in. Can you kind of tell me a little bit more about like what he kind of went over?
Yeah. So
If that's
he,
if that's okay. I don't know.
yeah. I don't think it's like privileged information really.
Cool.
Uh, so he just talked about what the stay-at-home order is and why they're
Mhm.
doing that. He talked about what they're doing with kind of supply chain and trying to get a hold of resources and like personal protective equipment. And that's where I got the thing about FEMA, sort of buying up the whole supply
Yeah.
chain. That's been one of his big challenges, is getting a hold of equipment and getting it to Minnesota. Um, and just it was yeah, it was just really kind of, I'm with you, I'm here to support you. Um, there was a lot of conversations about basically like, or a portion of the conversation was basically about how um, how what they're doing at the state level to kind of protect
Yeah.
people like income if they're like out of work, if they're in like a non-patient care setting, and kind of the processes, like what they're trying to do. There's nothing definite yet, but yeah, it was just mostly really like reassuring that he's there, in the trenches and doing what he can to support us and protect Minnesotans.
Nice. So what do you think is like the most challenging part so far, dealing with this pandemic and then
um I think I think one of the biggest challenges is just the fear and like
yeah.
everything, the from on a micro and a macro, on a personal level. Like
Mhm.
I have grandparents, I have parents, I have kids, and
Mhm.
you never know. Like, yeah, statistically most of young people will be okay, but some won't, and it's scary. um and then on a macro, the impact that fear is having on supply chains and people's behavior, and the way discrimination and other things that just are just reflections of the societal fear and the collective anxiety that's going on right now. I think that's one of the biggest challenges too, is just mitigating that, and then being able to come into a work environment that's, you know, drastically different than the day to day, and constantly be on high alert. You know, not stand too close to anybody, don't breathe on anybody, don't
Right.
touch your face, don't, you know,
Yeah.
uh, just living day to day with that heightened state of anxiety is just, it's exhausting.
Yeah. Oh, I bet it is, man. Like, I couldn't imagine being in that kind of environment, especially
Hmm.
since it's like so crucial too, you know? So you guys doing
Hmm.
a really good job just kind of just not going crazy and
Yeah.
stuff, in the healthcare system. And I feel really
Yeah.
bad for you guys because you know, it's not. I mean, yeah, I'm assuming you guys are probably used to it nowadays, but still,
Yeah. I mean, there's this whole thing about how, you know, some people say this is what we signed up for as nurses,
right.
and, you know, so, some didn't. Some
Yeah,
signed up for cushier nurse jobs and didn't plan on being on the front lines of a pandemic, but here we
yeah,
are. I think we're just doing the best with what we can.
yeah. And what do you guys have? Cool.
Yeah, exactly.
Um,
Resource.
cool, Ben. Would you like to add anything else that you want to cover?
Um, I will say that, I'm a writer, a blogger. So I've been writing kind of short updates on kind of my perspective, and, you know, maybe advice to people. So I did one about kind of what we talked about today, just basically what hospitals are doing to prepare for this and to fight this. Everything I publish is over on Medium, medium.com. I'm Ben period RN writer, to find me. But there's some really great stories being told there on that platform. It's some of the best independent journalism on the web,
Nice.
um, and yeah, that's where I get, you know, a lot of my information. There's some really reliable, like, epidemiologists on there, ER doctors, like people that are really involved in the front lines, and behind the scenes, and just really good firsthand information. So that's a great resource for people, as well. And um, so yeah, I would say go there and take everything you find, everything you read with a grain of salt and a deep breath. Um, you know, we're gonna make it out of this. We're all coming together, and we're working hard and doing everything we can to protect um, our neighbors, and, you know, just continue to be patient and stay calm.
Mm-hmm.
Um, you know, find ways to manage your own anxiety in your home and deal with, you know, the change everybody's had to change their life day to day, and kind of, you know, adapt to a new normal. And I would say just be patient. This is going to take a while. um, and, you know, just don't give up hope that, you know, staying at home and doing everything we can to reduce transmission, it is really helping, and it will continue to help. So just like, cases are going to continue to climb, and maybe
Right.
that'll make people think that it's not working, but it really is. It really does. And just, you know, participate.
Yeah, very good. So, Ben, you're gonna send me some of those links that you mentioned. So, guys,
Yeah, absolutely.
um, just yeah, I'm gonna put the links on this YouTube video. Just click the links and just check out what Ben's been doing and stuff like that. And also, please like, share, and subscribe this video as well. So until next time, guys. Thank you again for another. Thanks again for being here. Until next time, guys. Catch you later.